That. And joining us now is Massachusetts Democratic Senator Ed Markey, a member of the Health Committee. He joins me now. Let's start there. As you know, I don't have to tell you, Senator, Medicaid alone covers 72 million people of limited means, low-income individuals, both adults and children. Letitia James said unequivocally our Medicaid reimbursement system is locked. What can you tell us about what's going on in Massachusetts and your reaction to it?
Well, across the nation, 80% of all people in nursing homes are on Medicaid. Now, we have a name for those people. They're called grandma and grandpa. And 50% of them have Alzheimer's. When there is an attack on Medicaid, it goes to our most vulnerable seniors in nursing homes with Alzheimer's. It also goes to the most vulnerable children in Massachusetts, but across the entire country. And when the portal to Medicaid aid is frozen, well, that's casting a shadow over a lifeline for seniors, for kids, for families all across our country. And that is only the beginning of what's happening. It's doing the same thing for Head Start, for housing, for firefighters, fire grants, you name it, for veterans benefits. It's across the board. These are hardworking families who depend upon federal programs to help their families. And with the exception of millionaires and billionaires, we're talking about most families. They have someone who needs Medicaid, who needs help with their education, with their veterans benefits, all the way down the line. And Trump today has absolutely frozen the ability for the American people to get access to the help they need for their families.
We just heard in that press conference that Letitia James and other attorneys general plan to fight this. So that's one avenue. What can Democrats in Congress or Republicans who are concerned about it, what can Congress do?
Well, first and foremost, I think we should just say no to Trump's nominees if they are going to become the hatchet men and women for all of these programs. Now, let's be honest. This is Project 2025. The guy who orchestrated Project 2025 is now Trump's nominee to be the head of the Office of Management and Budget, controlling the spigot of federal money that goes to families all across the country that have been dependent upon, reliant upon that funding for decades. So now the curtain has been pulled back, and Project 2025 is the Office of Management and Budget, and he's going to be the absolute extension of Trump in the White House as king, is how he would want it, determining which programs live or die. It's unconstitutional, it's cruel, and it will not stand. But we are going to have to get up and fight. And not only do members of Congress have to stand up and fight, but so don't families, organizations all across this country. This is absolutely Donald Trump trying to turn himself into King Donald, and it is absolutely unacceptable.
Medicare, Medicaid, they would be among the many things that would be part of the purview of the new Health and Human Services Secretary. As you know, tomorrow you will have a chance to question Bobby Kennedy Jr. His cousin, Caroline Kennedy, just put out a scathing letter urging against confirmation. Among other things, she called her cousin a predator. She talked about him putting baby chickens and mice in a blender. She said he encouraged family members down the path of addiction. But we already know that dozens of Nobel laureates, thousands of doctors have signed letters saying the same thing Caroline Kennedy is saying, which is vote no. It does not seem to have moved the needle in any significant way. Will Caroline Kennedy, what is your expectation about this hearing and ultimately the confirmation vote?
I thank Caroline Kennedy for her courage, for once again reemphasizing that her cousin is unqualified and dangerous as the Secretary of Health and Human Services. We're talking about a man who went to Samoa, recommended that the people in Samoa not be vaccinated against measles, 83 people died, mostly children, and he casts a cloud over the measles vaccination, the polio vaccination, over the safety and efficacy of vaccinations in general. In 1900, in our country, 18% of children died before the age of 5. 18%. What happened? We had a public health regime that we put in place to make sure that ordinary families got the protections which they needed. What Robert F. Kennedy is going to do is to have a rollback of the confidence in that vaccination regime that we put in place and serve as a distraction, a dangerous distraction from what we should be talking about: access to health care, the price of health care, what Donald Trump is doing with his executive order to cut back on access to health care for families across our country who depend upon it. That's what we should be debating, not the science of vaccines, not the science of all of the breakthroughs that we have made over the last 50 or 60 years in our country. And that's what his hearing is going to be all about.